So why don't we start out with, why don't each of you just take a minute or two just to tell us who you are, what's on your minds, what it is you've been doing the last 5 or 10 years, and what you're thinking these days. So Dr. Funk, why don't you start?
Okay. Good evening, everyone. My name is Dr. Kristi Funk. I'm a board-certified breast cancer surgeon, as you heard. I live in Los Angeles, and for the last 5 to 10 years, I've been really honing my practice to be very balanced in terms of approaching women's breast health and then disease when present with a multi-pronged approach. Obviously, as a surgeon, I do surgery. It's not always necessary for the things that I see. Sometimes I see breast pain or nipple discharge, and I'm just diagnosing issues and offering advice. But I've really focused on how to help women feel empowered by the choices that they're making and how that directly impacts their breast health and their outcomes if they've already been diagnosed with cancer. I became board certified in lifestyle medicine in the last year, just for more street cred, really, and also following my own advice, which is to always be learning something new, right? The idea of grow or die and neurogenesis and plasticity are real, and you want to stimulate yourself. So that was one challenge I set before myself last year and became board certified in lifestyle medicine, which just furthers my ability to understand and then advise regarding how things like sleep or social connectivity really do make a cellular impact that makes your life not only healthier, but more joyful. So that's been my main focus professionally. Personally, I have triplet sons who are approaching 15 years old, and that could be a full-time job. And I spend a lot of time at home and with family.
Thank you. Dr. Freeman?
Well, it's nice to be here as well. I am a cardiologist in Denver, Colorado, and over the last probably 15 years, I've been honing and developing all the various lifestyle medicine parts of my career. I started doing Walk with a Doc about 14 years ago, where we walk with our patients, and then slowly started to change my own personal diet growing up in New York, living and eating the terrible New York way. And I too am originally from Long Island, even though I don't have that accent. And then when I did that, not only did I personally lose 30 pounds of fellowship gained weight from Philadelphia cheesesteaks, but I actually got a rebate check in the mail from my life insurance company, which I thought was pretty amazing. And ever since then, I've been doing this with my patients with incredible results, and it's been really exciting. Other than that, I have 4 children myself, me and my wife, obviously, and that's a full-time job, as you can imagine. But regardless, it's a lovely mix of work and life balance, and probably not as much sleep as I should get.
Thank you. So there are some people that are saying, well, this is a waste of time to watch this panel because, there's no, cancer and heart disease just happen. It's, what can you do about it? It's just bad luck. And so what's the point of hearing more about it? There's nothing I can do. Some people just have bad genes and, it's just really nothing you could really do about them. So is there something that can be done to make a significant difference in the likelihood of contracting heart disease or cancer?
Kristi, do you want to go first? You tell me.
Yeah, sure. I'll go first and tell you that nothing could be further from the genetic truth than to say that the vast majority of all breast cancer has nothing to do with inherited genetics. We know for a fact that approximately 8% of all women diagnosed with breast cancer do in fact carry a gene mutation. BRCA, CHEK2, PALB2. There's a handful of about 19 genes directly related to elevating breast cancer risk. And with several, and maybe not even all of those genes, but with a handful, like say BRCA1, the risk of getting breast cancer is so elevated. And the mutation in that gene, which is supposed to do like DNA mutation cleanup on your behalf behind the scenes, it's so handicapped, and that's such a critical function that most of those women are not going to necessarily outlive the plan of your cells to have this cancer form and then proliferate inside of you. In other words, it's so high risk. I'm not sure you can kill it off with kale and exercise. However, it's only 8% of women. So it's serious and a big deal if you have a gene mutation, but most people don't. Okay. So on the other end of our bell curve spectrum here might be a tiny handful of, I give it 5% of people where it's truly inexplicable. They do quote unquote everything right. They live well. They've been zenned out and meditating since birth. They eat plant-based. They sleep well. They have loving relationships, et cetera, right? They still get cancer. I have a theory about those people as well, but the point is it's hard to explain, but it's not genetic. Here we have the big middle bell curve though, right? We're talking literally 80 to 90% of all women diagnosed with breast cancer who cannot attribute it to a genetic mutation and who in fact have some major room for improvement in diet and lifestyle. This is like my hyper focus because these people can truly be educated and empowered to make small, stepwise, incremental, critical changes that absolutely directly translate to an alteration of the cell microenvironment. The tissues and cells that your own cells are bathing in, feed and fuel it toward disease or away from disease, be it heart disease or stroke or Alzheimer's or diabetes or cancer or something else that doesn't necessarily even take your life, but it threatens the joy in your life. So I'm talking about chronic stress, anxiety, depression, even just joint pain, irritable bowel syndrome, autoimmune disorders. They adversely affect your experience and your happiness throughout the day. And to think that you can control what's on the end of your fork and the decisions you make to how to spend your time. And in controlling those decisions, you are altering your insides and creating a healthful, positive impact on your day-to-day living.
I think those are amazing points, and the analogy I often give, as morbid as it is that your genes are perhaps loading the gun, but the environment that you put them in is like shooting it. And so genetic predispositions are an important thing that we all face. Some of us are very unlucky genetically, right? Your whole family might have potentially had heart disease before 40. And there are some things that we can easily fix. The vast majority of heart disease that's out there is preventable. There are some genetic anomalies, but that's not most of us. And so it's, a lot of those people who say, well, these are my genes and that's it, and I'm going to do whatever I want, I think don't understand that there's been a number of published papers that suggest that your genetics don't have to hold you hostage. It's really the genes, the environment that we put those genes in. And we know from a lot of the epigenetics, the way the proteins are made and then they ultimately fold matters. And that folding often depends on the environment we live in. So I guess what I would tell people is heart disease and cancer actually share a lot of the same pathophysiology. This is why cardio-oncology is such a booming field. And I think that a lot of it has to do with the way we live. Human beings were not designed or destined to end up with heart disease and cancer. I mean, that doesn't really benefit anybody. And so the goal here is to prevent all of that. And that can be done very, very well through lifestyle. And I do want to point out that it's more than just diet, of course. It's the exercise, the stress, the connections we make with others, how well we sleep, avoiding substances. All of these things together really are synergistic in preventing those bad genes from getting expressed the way that we don't want them to. So,
Dr. Funk, when you speak about breast cancer, should we assume that it applies also to prostate cancer and other cancers, or is breast cancer unique?
Breast cancer has some unique differences between itself and other organ cancers. Mainly that 80% of all breast cancers are fed and fueled by estrogen. So to the degree that we can modulate estrogen, bad estrogen in our bodies, we can decrease cancer risk and occurrence and mortality risk. However, everything else that I talk about actually directly translates to the decrease in morbidity and mortality from any type of cancer in your body.
So I have questions to ask you about different lifestyle things, but last year we had a speaker named Chris Wark. He wrote a book called Chris Beats Cancer. And
I know very well.
Yes. And he said that here everyone was all focused on our supplements and our diet and our lifestyle and our exercise and all the great things we could do. And he says, oh, and by the way, you have to forgive everyone. Now, when it comes to emotional health, a lot of us are angry. People hurt our feelings in life. People cheated us. There's a lot of things where we've grudges. Now, is this a real thing? Do we really have to clean up our emotional health and really forgive everyone and stop the anger? And is that a real thing that's really affects cancer and heart disease? Or is there proof of that? Like, it seems a lot of us are willing to jump in ice baths to be healthy, but we're not so sure we're willing to forgive everyone in life that hurt us.
Absolutely. Well, that's a little bit more difficult than just the brave leap into cold water, to kind of forgive others and forgive yourself, takes a lot of ownership, and that can be difficult. I think Chris' work is absolutely correct, and studies, absolutely, I'll let Dr. Freeman expand on this, but for sure, studies have shown a decrease in blood pressure, and cardiovascular outcome can be affected obviously directly by that. It lowers cholesterol levels, improves sleep, and has been shown to lower the risk of heart attack. It has not been shown forgiveness and well, what is it about forgiveness specifically? It's truly that the act can reap health benefits in that it decreases your adrenergic responses, right? Your sympathetic and nervous system, because it takes energy to be chronically angry and resentful of people. It puts you in a fight or flight mode, right? Which results in numerous changes like your heart rate going up and your blood pressure being high and your immune response being dulled because you're creating some immune system dysfunction when it lives in that chronic inflammatory fight or flight state. And so the studies that I've seen actually do literally correlate forgiveness to calm, which then lowers stress levels that are measurable. So we're talking about IGF-1, C-reactive protein, interleukin-1, interleukin-6, tumor necrosis factor, natural killer cells. All of these are very measurable in your blood, and they've been shown before and after in forgiveness studies to alter. And when you lower reactive cells that create inflammation, you're going to have a better health outcome. So in essence, forgiveness equals stress reduction, which equals a boosting of your immune system and an ability to live healthier.
I think that the vast majority of cardiologists you meet will probably have that type A personality or the intense personality, and maybe some surgeons. Many times people will say that cardiologists are surgeons that didn't want to do surgery. And you probably know what I'm talking about, Dr. Funk, because surgeons often have that very intense personality. And it turns out that personality type is associated with worsened cardiovascular outcomes on a variety of levels. But even the words we use on a regular basis in common parlance, like disease, dis-ease, or lack of ease, when you're angry and you don't have ease, and then hypertension, right? Too much tension. And it turns out that lots of this sort of intense rage and anger that many of us develop, particularly during the pandemic, is not a great way to live. And it turns out that it raises a variety of different issues. In fact, there's even data suggesting it raises cholesterol and increases heart attack risk. So in general, figuring out how to let things go is super duper important and powerful. And many of us have very intense professions where, we have lives at stake. And sometimes we do everything right for a patient and they still die. And then, going back and reflecting at the end of your day, did you do everything you could? Did you go the extra mile? And then forgiving yourself for those bad outcomes, which is a very hard thing to do. So in short, I think, mental capacity and resilience is a really important way to keep people healthy, and it's hard to develop, but it's a skill like anything else, and it takes time to get there.
Thank you. Both Dr. Caldwell Esselstyn and Dr. T. Colin Campbell are going to be speaking at the conference. They're both 90 years old. And Dr. Esselstyn had made a point of using the phrase heart attack proof for people that were following, I guess, the whole food plant-based diet and had a cholesterol below 150. And Dr. Campbell in the China study had said that the rates of heart disease and specifically cancer for people who were eating, I guess, a whole food plant-based diet were dramatically lower. In your experience with your work and your patients, do you find that people that follow this lifestyle don't get heart attacks? Don't get heart attacks? And then do they not get cancer, or do they sometimes get cancer? You kind of answered that, but the cancer, but like, if you do all of this stuff, how heart attack proof are you, and how protected are you from cancer?
Maybe I'll jump in first on this. So first, let me just say that you could be the healthiest person on the planet. You could eat only plants and exercise 1,000,000 hours a day and have no stress and, whatever it is, and you could still be hit by a bus, which would be awful, and it happens. So in short, death is part of life, unfortunately. And so figuring out when that is and trying to delay it is important. But what I want to point out is the American curse is a real thing. People work hard their whole lives, they save their money, they get ready to retire, and then what do they look forward to? Not death, but suffering first, with heart attacks, strokes, breast cancer, right? Dementia, erectile dysfunction. It's a terrible way to retire. And so the question is, if we live this way, can we live into an older age feeling well and doing well? And it's one thing to be alive, and it's another to be alive and well. And so my personal hope is to be a grandparent or maybe a great grandparent and be dancing with my great grandkids at their weddings or whatever happens in their lives, rather than being drooling to myself in the corner like many old people in the United States, which is unfortunate. And so figuring out how to get there is important. And when we make these lifestyle changes, it is not a guarantee, right? So when I went plant-based, nobody issued me a guarantee that says you shall live to be 120 years old and feel great. I mean, that'd be lovely, but they didn't. But rather, this is a hedge against my genes, if you will. So as I mentioned earlier, your genes don't have to hold you hostage, but at some point aging occurs and sometimes your genetics do play a role. And we all know people who can live to be 119 and drink out of a fryer and smoke a carton of cigarettes a day. And they're very lucky people, but you don't know you're that person until you get there. So making these changes now will hopefully make it much more likely for me to live to a riper old age, feeling great, doing great things, and maybe I'll be lecturing, until I'm 100 instead of 90. Who knows? But my goal would be to avoid the common American ailments if I can.
Thank you.
And for my answer, I think if you are someone who's really grasped and implemented the recommendations of doctors Esselstyn and Campbell, you can still get cancer, of course, because it's not truly a bulletproof vest that you're putting on internally and externally. However, what I have seen across the board, except when people have a genetic mutation underlying their cancer causation, which is not most people, remember, about 8%. So when I see someone who has really been following the whole food plant-based prescription along with exercise and sleep and social connection and avoidance of toxic substances, including and especially when it comes to breast cancer, alcohol, and they still get breast cancer. Okay, I have an ever-growing number of women with these cancers that if you just gave me the path report blinded to age, I would say, is she 110? Like, this is a little old lady, lazy cancer that if you had never diagnosed it, would never kill this person until she's 250. So even for the best of us currently doing what we do on Earth, no one's making it to 250, right? And honestly, like literally today, I got a path report from a lady who flew down from Seattle because it was whole food plant-based. She's ripped, like envious of her biceps. She's 53 and came to me though, actually crying and scared because she felt this lump. It was so tiny and it was ultrasound negative. I could feel it. It was this little big between a pea and a marble, like that size. And so I knew exactly where to go, held it between my fingers, put the ultrasound probe down, and it wasn't there. And I biopsied it anyway. The biopsy came back invasive breast cancer, but it was a subtype that's tubular, behaves almost like a stage 0 in situ cancer, through the roof with estrogen receptors, which is what a less aggressive, more curable breast cancer will show. But here's the key. The division rate, the percentage of cells that were actively dividing, so 1 becoming 2 under the microscope, was, I'd never seen this, less than 1%. Like, I've never seen a number that low. I've seen actually a couple of 1%, but this was less than 1%. This thing is so slow. And what that means is in a 53-year-old is that less than 1% of the cells are duplicating over about a 3 to 4 month period. So that's insanely slow. If you do the math on that, let's just do easier math and say it was 10% dividing. A 1 centimeter cancer in about 3 months will be 1.1 centimeters because 10% of the cells are dividing. But in her, it's less than 1%. Why? Because of her diet and lifestyle. And that's where I like made her wipe her tears away. And I'm like, listen to me, this is probably cancer because it feels like it, but let's biopsy it and prove it. And even if it comes back cancer, I can actually promise this woman, it's impossible for her to die from it. And that is what I'm finding with my patients. I think they need a good 10 years of that real cleaned up internal low level inflammation to then create a cancer that's pretty wimpy. Like if its goal is to kill you, is not going to happen.
Thank you. What is your experience in the real world with people that say, yeah, I don't really think the whole food plant-based is the way to go. I'm a total believer in the paleo, keto, low carb diets, and they have their gurus that they follow, they have the books they follow. What do you see when you treat them, when you look at their scans, when you look at their numbers? How are they doing? I mean, there's a lot of people, if you go to Amazon and look at the bestsellers, it's always filled with keto and paleo books. And they're very confident and they speak very strongly. What is your experience about the health of the people who are using this approach?
Dr. Freeman, do you want to take that first and ask these people about their coronary artery calcium scores?
Yeah. So the truth is, no professional society on the planet endorses a paleo or keto diet with the exception of for 1 or 2 rare neurologic diseases. And the reason for that is the evidence base is not there. It's dangerous. And yes, when people do follow a very low carbohydrate diet, they tend to cut out the garbage carbs that I commonly call carbage, and they end up losing weight. And when they lose weight, sometimes some of the risk factors get better. There are some people that I know that can somehow subsist on this diet, although they are probably markedly increasing their cancer risk as they eat things like bacon wrapped scallops every day. Scallops in themselves are very high in cholesterol, and bacon is considered to be in the same category as cigarettes by the World Health Organization for its cancer causing. And so in general, these people are putting themselves at great risk. And then from a cardiovascular perspective, many of these people feel miserable even after the initial keto flu that they endure. And then many of them have LDLs, bad cholesterol, that goes up 300-400 points. I've even seen some people have heart attacks while on this diet. And of course, it's hard to say the diet caused this, but it's quite likely in my mind. And so in general, there are some people out there that have some sort of genetics that allows them to feel okay on this plan. But the vast majority of people, I have not seen positive results ever, really. So.
Agreed. And when you ask how I approach these patients who are really clinging to their current diet, I don't try that hard to dissuade them because I think there's a pretty thick wall between my mouth and their ears. But I do beg them, if you're going to continue on this diet, just promise me that you will regularly be checking your blood work. And in particular, I want you to promise me that in 3 months, you'll do a coronary artery calcium score, which is going to be more important than maybe the cholesterol checks, because sometimes in keto diets, as Dr. Freeman was saying, the profiles like the HDL, LDL, overall cholesterol, they can look improved because they are getting rid of a lot of the carbage. Obsessed. That is a funny, great term. Never heard it. And an oral glucose tolerance test, because your diabetics can actually seem to have less insulin resistance and lower their insulin requirements if they're insulin dependent. But when you really put it to the gold standard test of eating liquid sugar and watching what their insulin response is over the ensuing few hours, you will find that they're worse than they were before. So again, what Dr. Freeman was saying in part is that we lack any long-term data. There are no randomized controlled trials making keto and paleo the knockout winners. All of the trials are very short-lived, weeks to months at best, partly because it's not a sustainable diet. And I think partly because maybe as certain people think about doing such a study and maybe do some individualized testing on patients, or they find that the data isn't the way they want. So they're not putting it out there. I don't know why we don't have long-term data on keto and paleo diets, but I think it's dangerous. And when you ask how I approach a patient, I say, well, I think the balance of evidence in nutritional science points away from animal-based keto eating and toward plants. And here's my book. Maybe you want to read chapters 3 and 4. You know, I'm gentle on them. It's that's not their moment to come to kale, and you know it. So I just give them a little bit of advice.
Thank you. What about salt? In other words, a lot of people say to avoid it completely, and then there are some authors that say that it's okay, or it's not that big a deal. I personally eat a whole food plant-based diet. I'm very, very serious about sugar, but if the guacamole has salt or the flax crackers have salt, I kind of think, maybe it's not that big a deal. So in terms of heart disease and cancer, do you have any what is your thought on the effect of salt?
If you look at the population wholes, right, Americans consume far too much salt. The number one source of most salt in most Americans' diet is actually in the form of poultry, which has been brined or injected before it's consumed most of the time. But assuming you're not eating that stuff, the occasional sprinkle of salt is probably not nearly as bad as the food that contains salt. And so my guess is in your guacamole or occasional flax crackers or whatever, you're probably not getting that much salt. But the vast majority of Americans are consuming too much. And from a population level, many of those people then have high blood pressure, which markedly accelerates cardiovascular disease risk. And so in general, I usually tell people to try to limit it to, 2,000 milligrams or so. There is some data that in people who have perfectly normal kidneys and don't suffer from hypertension, that salt loads may not be as harmful as we once thought. But in general, the advice that I would give everybody listening is we all eat way too much salt, and things that you don't think are salty are super salty. As an example, many of you are in New York, one, sour pickle could have a full day's worth of salt. A bowl of raisin bread can have 600 milligrams. 2 slices of bread can have 400 to 600 milligrams. And so it's very, very, very easy to pile up the salt. So when you eat a largely unprocessed and unpackaged diet, it's much more difficult to get that salt. And I probably wouldn't worry too much about the occasional sprinkle people add to things. But if you're a big restaurant foodie type, you got to be careful because they salt the heck out of everything.
Yeah, interestingly, a study just came out on Monday, so April 8th, 2024, that was looking at, it's a meta-analysis of a number of randomized controlled trials, and they showed that people who use salt substitutes, and by the way, the substitute was 25% potassium chloride, 75% sodium chloride. So interesting, because sodium chloride is the bad one, right? So it still was heavy on the salt when we were talking about salt, the sodium. And yet what they found is that after up to 10 years use of salt substitutes had a statistically significant drop in all-cause mortality and cardiovascular disease for those who substituted their salts. We, in our house, because, if you look at how dietary choices impact mortality, the top 5 things that lead to an early unwelcome death that we have control over and are 100% diet related. 1 is an excess and 4 are lax. So the number 1 cause of dietary death on planet Earth is excessive salt. And when I read that, this was when I was studying for my board certification in lifestyle medicine. When I read that, I bought bags, like 2-pound bags worth of potassium chloride, and filled all the salt containers in the house with it. And nobody was the wiser, except after I told them. And all of a sudden, Sebastian especially was like, oh, I knew this tasted awful. And he's such a little rat because he oversalts everything. He's like, Mom, I'm an athlete. I sweat a lot. I need extra salt. And he had no idea. So I challenge you to try that, or try a mixture of potassium chloride versus, and now that everybody's like, well, what are the other 4? The other 4, I forget which order exactly, but it was not enough. So first is too much salt. That was number 1. And then I think the order was not enough fruit, not enough whole grains, not enough vegetables, and get this, not enough nuts. That was number 5. But of course, it's not roasted, salted nuts, or that would bring you back to number 1.
Thank you. If you if we right now want to just get a base level assessment of our health, what tests are we supposed to get? If I came to see you, or if someone came to see you and you want to just understand where they were and they said, I feel fine, I don't know what's going on really, what are the basic tests that a 50, a 60, a 70-year-old person should be getting, what that you would like to see us all get to get a base level of what's going on with us? What are the most important tests if we were on next week going to go get tests?
So from I want to caution the listeners about this. You know, there's a lot of programs out there. There's concierge programs and executive health programs and these trucks that go around in 18-wheelers, and they can do all these things for $200 or whatever. You really first get what you pay for, so be careful of those. Second is, this is a very individualized discussion that needs to occur with someone who understands prevention and cardiovascular disease with a patient. And so what I would say is, of course, age-appropriate cancer screening makes sense, and the evidence out there would support that, as do the professional societies. You know, in my book, every patient that I take care of, especially as a new patient, will typically have an EKG, and most of them will have basic blood work, a blood chemistry, a blood count, thyroid, and then I do a lipid panel, which checks lipoprotein A. As you may know, 1 in 5 people worldwide has this. Each lipoprotein A particle is 5 times more atherogenic than LDL, so it's a very potent risk factor, and it's associated with early heart disease and valvular disease, and it's 90% genetic, so it's important that people know about it. Regardless, that's what I usually start with. And then depending on what patient's symptoms are, we may talk about doing a calcium score or even a CT angiogram or what their risk factors are. And it's a very individualized discussion that there needs to be a pro-con discussion with the provider. I think anyone who gets up here and says, oh, you should do these 20 tests is probably not being a judicious steward of resources.
Thank you.
I echo Dr. Freeman. I'm not big on tests, but that's also my discipline is very focused on breast. So I'm not routinely ordering blood work. However, for cancer screening, for sure, I have something to say about that. So pap smears should start at age 21 and continue every 3 years until about 65. And then you can space it out to be every 5 years and, or just depending on your circumstances, make a change in the frequency. Colonoscopy needs to begin at age 45. And if you're clean as a whistle, you can do it every 10 years until 75 and then individualize it. Mammograms, super controversial, especially in our current audience, I'm sure, because we're very focused on health and wellness. And we know that there's some serious drawbacks to radiation and mammograms and some other issues. However, it is still our gold standard in screening. And even the USPSTF changed their recommendations from 50 to 40, like a soft call on 40 to begin mammography. Different societies have different recommendations, but if you're wanting like the, platinum level care here, we're talking annual mammograms. So every year between 40 and forever until you are pretty sure you're going to die in the next 5 years from something else that's going on. And then you get to stop. If you have dense breasts, I always add whole breast screening ultrasound to the annual regimen, usually spaced 6 months apart from the mammogram. So I'm doing an imaging on the breast twice a year. If you are also then at elevated risk, perhaps because of a strong family history, maybe you carry a gene mutation or you yourself have had a cancer, breast cancer that mammogram missed, then we call that occult, mammo-occult cancer. And these are all good indications for doing a breast MRI. That has some serious downsides, including injection of a heavy metal called gadolinium. So I don't use that willy-nilly. It's very strategically planned for given women, and it might be every year for the highest risk people. But usually I default to something more like every 3 years if they're high enough risk to even need one at all. Blood work, I think if someone's already going for blood work, like with their medical oncologist, I'll just throw my 2 cents out there and be like, hey, why don't you check? And I'll have a look at it. Your vitamin D. So that's always in the cancer patients routinely checked. You need it between 40 and 80 nanograms per milliliter to be in an optimal breast cancer reducing level. people with low calcium have been at elevated breast cancer risk, and same with B12, and especially my plant-based eaters, then you probably know that we need to think about supplementing, and we need to do more than think about it. We need to supplement with B12, and potentially EPA, DHA supplements, and D and vitamin D. So if that's low, we got to get it up to 40 to 80, and that can sometimes take some serious supplementation doses, like 10,000 milligrams.
Right. There's a cancer test called, I think, Galleria, that tests for like 50 cancers from your blood. Do you recommend that?
So Gallery is a pretty cool, interesting new test. It was developed specifically to detect high-risk tumors that are generally diagnosed too late. So stages 4 for sure, but 3 and 4 advanced stage cancers include a top 12 for them. Things like pancreatic, ovarian, lung, colorectal, and a handful of others. And so the sensitivity, the ability of this Gallery test to pick up early stage 1 and 2 cancers, like, wow, that's life transforming, because usually these cancers that I've mentioned really require some symptoms that already suggest advanced stage and more than likely too late. Ovarian and pancreatic are notorious for that, right? So this test was designed to, like, hey, let's pick these fatal cancers up at stages 1 and 2, and now everybody's got a good fighting chance against dying from them. And so their ability to pick up these more aggressive cancers at stages 1 and 2 can be like 50 to 80% of these early stages that they'll find. In contrast, breast cancer, stage 1, found in 11% of all the stage 1s that they screen. That's not helpful to me or to my patients. That's missing way too much, but it was designed that way on purpose. So long answer is, I use Gallery very selectively, usually in gene mutation carriers who then are at high risk for specifically ovarian, pancreatic, and some others, cancers that are hard to screen otherwise. So be smart about it. It's never covered by insurance and runs about $900, and it's a snapshot in time. So it's not like a one and done and you're never going to get ovarian cancer. It's you don't have it now that we can detect, and you should probably check again in a year. So it's expensive.
Thank you. So just to be clear, what is your actual prevention protocol? If someone said to you, okay, just give me what exactly I should do. We've talked about it a little, but what is your 5-10 step plan of what you are saying that every one of us for the rest of our lives should ideally do to increase the chances of us staying healthy and avoiding heart disease, cancer, and other illnesses?
Dr. Piggyback on anything else.
Sorry, go ahead. You go, Kristi.
No, I was saying you go first, and I'll piggyback on heart. Heart disease outranks breast cancer, so you go first.
Yeah. So, remember that all the things that you've heard us talk about are the same recipe for prevention, right? So it's really eating a predominantly low-fat, whole food, plant-based diet. It's regular exercise. Obviously, check with your doctor first to make sure that's okay. So that's 30 minutes of breathlessness a day that we're looking for. In most cases, every day if you can. Third is stress relief, some form of mindfulness, meditation, or stress relief. Fourth is sleeping enough. We're always looking for about 7 to 10 hours a night of uninterrupted sleep. And if that's a problem, see your doctor. It is connectedness. So the people of the most love and support in their lives truly have the best outcomes. So I highly recommend that. So we talked about diet, exercise, stress, sleep, and connection. And then the last part, of course, is to avoid substances. And that includes tobacco, air pollution, marijuana, which is a very big thing here in Denver, and other forms of substances, so other street drugs and even alcohol. So if you can do all of those things, the likelihood of disease becomes much less, but it is not zero.
Yep, definitely. You get an A+ on that list. To it, I might add, with stress reduction, exercise is a great way, but meditation is very helpful. Gentle stretching, Tai Chi, forgiveness, like we've talked about, is great. Fasting. So it's not just eating well. It also has to do with examining when you don't eat. So intermittent fasting, there's been a lot of very recent literature suggesting that skipping breakfast elevates cardiovascular risk and early mortality. but that doesn't mean you still can't get a minimum window of 13 hours of not eating. Some studies specifically with breast cancer show that 13 hours or more, so more is better, so up to 16 hours of not eating. So your fasting window is 13 to 16 hours. Those women have a 36% drop in breast cancer recurrence at 5 years post-diagnosis, as compared to women who have a shorter fasting window than 13 hours. So intermittent fasting is very useful. The makers of Prolon, most of you may know what that is. It's developed out of USC, University of Southern California, Walter Longo's lab in the Center for Longevity. It's been studying pathways of aging, and what ages you are these protein driven pathways like mTOR and PKA, and what accelerates aging is also going to accelerate killing you. So it includes things like cancer and heart attacks and stroke and diabetes. And the two major ways to slow down that pathway to aging are to eat a plant-based diet. Honestly, you should have turned this entire podcast off if that weren't one of the answers, because we've all been big proponents of plant-based eating, or Summit, I should say. And the other one is eating it all. So now we're back to fasting, and it turns out you really rev up autophagy, phage eat. So the cell scavenging mechanism of like, hey, who's damaged and deranged and senescent and just buzzing around, spewing out inflammatory markers all day long, because you are not doing this body favors and you have to go. A good night's sleep does not get you into autophagy. Fasting overnight and pushing it to be an OMAD, 1 meal a day person, and you're fasting like 23 hours a day, that doesn't get you into autophagy. You need to not eat for about 72 hours. And what Longo's lab identified was that people aren't going to drink water for 5 days. So they developed, with $30 million from NIH, a box of food. It's kind of ridiculous to pay like $200+ to not eat, but it's like this box of 5 days worth of food. Or you could do it supervised, perhaps on your own. A DIY plan for Prolon is all over the internet. I don't know. I just get worried if I do a DIY, I'm going to just have just too many carbs or a bit of protein, too many nuts in that one bite, and boom, out comes insulin and destroys my 5-day fast. Even I just pay the money and do the Prolon. They just actually had a point. I started by saying they just published data that showed if you do this Prolon 5-day fast 3 months in a row, 5 days each month, you will reverse your biological age by 2.5 years. That's pretty fantastic. So if you are not underweight, I think that's something pretty cool to investigate doing. But beyond that, I think you should do these prolonged fasts about 3 times a year, so every 4 months. So I would add fasting to our lifespan, health span plan.
Great, thank you. Dr. Freeman, do you want to answer that same question about what your exact protocol would be?
I think I started the conversation. So
okay, you started. Sorry about that. Okay,
that's okay. I don't think I would add any more.
Okay. Now, what about we talk about avoiding animal products, but what about fat from whole food plant sources such as raw nuts, raw seeds, avocados, and olives? And then specifically, what about saturated fats in nuts like macadamia nuts or maybe cashews or Brazil nuts that have more? Because a lot of times people use the term saturated fat as bad, and even the word fat is bad. But what about when they're from nuts, seeds, avocados, and olives, and specifically high saturated fat nuts like cashew, Brazil nuts, and macadamia nuts? Is that a concern?
You know, interestingly, there's actually a study out there that showed like something like 1 Brazil nut a week actually can lower cholesterol, interestingly enough. So I think the way plants produce fats in the matrix of the plant itself doesn't seem to be nearly as harmful as what we get from animals. But that said, all of those foods are highly caloric and should be limited. And that includes the oil forms of these things. So for instance, tropical oils like coconut, which are very high in saturated fats, even higher than lard, are actually not recommended by any of the professional societies for their risks of coronary disease and other things. So in general, I usually recommend that these things be used sparingly. I always joke that the worst thing that ever got invented was shelled pistachio nuts, because they're really easy to just take big handfuls and eat them up, and the shells are designed to really slow you down. So I think if people can figure out how to eat these things in moderation, it's great. Now, a lot of people will call them, especially in the plant-based world, this sort of gateway drug, right? Where first you eat a nut here, then you have nut butters, then you have nut bars, you have all these things, and before long you're eating all these high calorie foods, and it's very possible to do that. So remember that the human body really enjoys a fatty sort of sweet taste, which many of these nuts provide. And so they really do need to be used in moderation.
Thank you. If you could access any 5 data points, including results from any medical test, detailed information on individuals' diet or exercise habits, level of any mineral or vitamin, cholesterol levels, blood sugar levels, salt intake, which would you choose as the most crucial to predict which among a group of 1,000 40-year-olds are likely to maintain good health until 95 years old?
Want me to take that one too? So, we know that as we go through life, what we do early in life matters a lot. In fact, even what we do in utero, which is not really our choosing, matters a lot. So in general, you may have heard of these Life Simple 7 or Simple 8, depending on which year you look at the AHA. But people who follow those habits as a lifelong venture do better. And so we also know that people who are thinner and maintain a healthy body weight do better longer too. So in general, if you said to me, pick the 40-year-old out of the crowd that might live the longest, I'd probably be wrong, to tell you the truth, because none of us are that good. But that said, it'd probably be the person who's not smoking, not drinking, exercising regularly, eating plants, maintains good relationships with people, has a healthy way of dealing with stress, and maybe doesn't come from a family where everybody died early for some reason or another. And then hopefully, they have the best genetic lot and the best environmental lot, which will carry them all the way through.
Great, thank you. Dr. Funk, do you want to try to answer that one too?
Sure. I think if I were to just look at some tests, I think Dr. Freeman, you would agree, what of all the cholesterol panels, et cetera, do you think a lipoprotein A would be the most important? If you just had one cardiac indicator on a blood test, what would you say?
I'm not sure it's hard for me to say that there's just one. Lipoprotein A is a very potent risk factor, but so is blood pressure, for instance, and smoking. There's so many that we could choose from. And I think, sometimes there is some data out there suggesting that even if you have a high lipoprotein A, that if you live in a better environment, the risks may not be as high in the all-comer. It's very limited evidence. I wouldn't hang my hat on it, but it's interesting. But that said, I'm not sure. I mean, you could also get a calcium score on these 40-year-olds. And if anyone of them has calcium at 40, which some people do, you could argue that their longevity is probably less, at least actuarially speaking.
Yeah, I think that would be a good one. We'll do a calcium. We'll take that. We'll do a calcium score and a hemoglobin A1C, right? We want to weed out the pre-diabetics and intervene early and get them back to being insulin sensitive. The younger, the better. I think, as Dr. Freeman was implying, just a straight up body mass index calculation would give us a strong indication if this person is, their body composition gives us an indication of future mortality. And if you could one up on that and do one of these like sort of body MRIs that give you the volumetrics of your, where your fat distribution is and whether it's white fat, brown fat, and if it's subcutaneous or intra-abdominal, so nestling around your organs, that intra-abdominal fat is directly associated with early mortality. So body mass index is a very poor man's way of getting that data. So if I could have whatever I wanted, I would get some body composition volumetrics on fat. I think that would be very helpful. People with low, we've touched on vitamin D, but people with low vitamin D have early mortality. So I would check a vitamin D level. And I'm kind of obsessed with IGF-1. So I just love to check people's IGF-1 levels. We know it is an absolute mandatory ingredient to all cancer formation and all type 2 diabetes. Like, you just have to have an excessive amount of insulin-like growth factor because it is the biggest growth promoter inside our bodies. So that would be my 5th thing to check.
Thank you. Okay, so we're going to continue with Dr. Funk. Dr. Freeman's been with us for 3 hours, so we're going to let him go. Dr. Freeman, any final comments you want to leave us with? Any final thoughts to share with our audience before you leave?
Yeah, first, it's been lovely to be here and I really appreciate it. And I think if it takes your audience 17 days to realize this is the way to live, we have a big problem. So I'm hoping they catch the key parts of all these great talks and people and leave with the concepts that a very simple life. And the wisdom I'll give everyone is, if you can live like a peasant, eat like a peasant, and move around like a peasant, you can feel like a king or a queen.
Great. Thank you very much for participating and sharing your knowledge with us.
You bet. Take care.
Thank you.
Bye.
Okay, Dr. Funk, continuing with you. So based on all your studies, we're using the word whole food plant-based, but are there some that are more anti-cancer preventing than others? Are there top foods that are the most powerful in preventing or dealing with cancer in terms of the plant-based world?
There definitely are. And if you didn't see my lecture, I have these top 18 anti-cancer foods that in the science are able to, in part, not completely, thwart the mechanisms by which cancer grows and proliferates and then metastasizes. My very top recommendations to get inside your body in some way every single day are broccoli, particularly broccoli sprouts, which have 100 times the sulforaphane content of broccoli. Broccoli lightly steamed or raw. You can have your roasted broccoli if it's your favorite food on planet Earth, as it is mine. So you roast broccoli, and if you don't know this tip and trick, so the enzyme myrosinase that converts your isothiocyanates into the magical sulforaphane, it's not naturally in the food. It is the combining of the myrosinase enzyme that then transforms the precursor into the magic, right? When you cook the food, you destroy the enzyme, you have no magic. So all you have to do is, on your roasted broccoli, chop up a few florets, a couple tablespoons worth of raw broccoli. You could also use any other cruciferous vegetable which has its intact myrosinase, such as some arugula or kale, raw, and or mustard, whole grain mustard or mustard seed powder will do the trick. Long story longer, broccoli. Okay, cruciferous veggies, but broccoli's king and sprouts are the crown. Next up, flax seeds. 1 tablespoon of ground flax seeds every single day. Throw it in your daily smoothie if you're having it, or throw it on oatmeal if you're having that for breakfast. Maybe toss it on a salad. It just gives a little nutty flavor to it. Mix it in rice. It's pretty easy to sneak your flax daily into your meals. Number 3 is soy. So this shocks some people. If it does surprise you, Google my name and soy, and I think some of my PowerPoint presentations might show up, because there's strong science. Every single human study ever done looking at breast cancer and soy shows an absolute protective effect for the vast majority. And for those that don't show a statistically significant protective effect of soy, it's neutral. Like, it's never, ever been shown to cause cancer unless you're a rat, which we aren't. So soy comes in fermented forms that may be more digestible to you. Tamari, tempeh, miso, natto, and then lightly processed soy milk, tofu, soy nuts, soybeans, tofu it up. Those are my top 3, vying really like neck and neck with berries. The procyanidins and other phytochemicals in berries have such a strong association with decreasing cancer risk, but also Alzheimer's risk, improving cognition. So berries are pretty darn critical, as are mushrooms. Mushrooms are potent aromatase inhibitors. Aromatase is an enzyme in your fat that's making excessive estrogen. And get this, a tiny 10-gram piece of, it's 1/2 basically of a button mushroom a day decreased breast cancer by 64% in a huge group of Chinese women. and followed for like 10 years. So mushrooms and the lowly white button beat out all of the expensive like portobello and crimini and la la la. Okay. So white button mushrooms. And then, so I have that top 18, but one spice that I'll just throw out. I'm not sure if we qualify spice as food, but turmeric. Turmeric really has such potent anti-inflammatory properties that it's a must get inside your cells every day.
Do you have any thought on, there's a professor, Thomas Seyfried at Boston College, that says that the food of cancer is glutamine and glucose. And because of that, he's saying to avoid sugar. And then some other people, Brian and Anna Marie Clement and Gabriel Cousins, are taking that and saying you should avoid fruit if you're sick at all because it feeds yeast, mold, fungus, and cancer. So when you have a healthy patient, would you tell them to limit fruit? And if you have a cancer patient, would you tell them to limit fruit?
Never limit fruit. Have as much intact whole fruit as your heart desires, diabetic or not, cancer or not. Does cancer eat sugar? Yeah, of course it does. It's a cell, and its only real fuel is glucose. And so Seyfried, his theory basically postulates that cancer cells rely almost exclusively on glucose for their energy. And therefore, you can make these dietary changes that severely reduce carb intake and therefore glucose availability, and you can effectively, quote unquote, starve your cancer cells. And that may be true, actually, because what uses sugar the most it's faster. So cancer cells inherently divide faster than your normal cells. So they use more sugar than your normal cells. But if you effectively starved your entire body and your cancer of sugar such that the cancer cells died, you would die because your body requires sugar. And literally your red blood cells and your 30% of your brain cells demand it. They're like, keep your ketone bodies. We are only using glucose around here. We will break down perfectly good muscle in a process called gluconeogenesis just to make our glucose. We will do it. And so now you're going to start breaking down your healthy body parts. But he's not wrong. And he's got something going on there to say that, because basically the mitochondria are like these powerhouses of the cell. They create the energy for us. But his theory is that mitochondria produce energy by fermenting glucose and glutamine. And when you ferment these as a cell, as a cancer cell, to create your energy, you produce reactive oxygen molecules. And so that's oxidative stress, right? And now we're back to the beginning. Like, this is what cancer thrives and survives on. It loves the chaos of oxidative stress. So now this fermentation that the mitochondria are doing are promoting further uninhibited cancer cell mutation and proliferation. On the flip side, ketone bodies, right? So he's a proponent of a ketogenic diet, but we've already talked about the limitations and the lack of long-term sustainability of a ketogenic diet for most people, and or at least leading to other things that kill you. So yay, you starved your cancer and it shrunk, but oh, sorry about that heart attack that put you in the casket. You look thinner though. So he's saying ketogenic diet, what's happening there? This is smart. I mean, it could be true, and it could be used in a limited setting and along with other therapies, right? We can't completely, in every case, get away with shunning surgery, even radiation, chemo, estrogen therapies, immunotherapies. These tools are in our toolbox, and they are effective weaponry again, and when judiciously used. Ketone bodies, right? So your ketogenic diet, guess what? You don't have glucose, so it's not flying around. Ketone bodies are. And guess what cancer does with ketone bodies? It spits it out like, I'm not using that. And it's too stupid to know that it has to, or it will die, so it dies. And that's the theory behind all of that metabolic theory of therapy, that you go ketotic, and in the absence of glucose and glutamine, the cancer cells literally starve, and healthy cells are like, I'll take the ketones, bring it on. So you're okay, Your healthy cells use ketones, except like I was saying, 30% of your brain and your red blood cells. And so you're going to probably lose a little lean mass in the process. Not a bad trade-off if you are truly starving and killing cancer.
Okay, thank you. Dorothy, would you like to ask a question, and where are you from?
Yeah, hi. I'm Dorothy from New York, and I wanted to make sure I understood some of the comments that were made about intermittent fasting. I think it was said that fasting up to 16 hours is a good thing, but that skipping breakfast was not a good thing. So my question is, if I were to stop eating at 8 o'clock at night, and let's say I woke up at 8 in the morning, that would be 12 hours of fasting. Is it beneficial for me to fast 4 more hours until noon, or is that considered skipping breakfast and is bad? I'm a little confused on that point.
Thank you for asking that question, because that would be unanswered, so therefore confusing. I think the data, as I interpret it now, is that skipping breakfast is bad, and breakfast would be defined as eating it basically before 11 a.m. So you could, for 2 reasons, for that reason of extending longevity, shift your window backwards a bit. Instead of stopping at 8, stop at 6, and you can have breakfast 16 hours later, which is 10 a.m., which makes it into the breakfast window, right? And you can also realize that calories are not the same depending on what time of day you're eating them. I mean, it kind of just stands to reason. If you front load your calories in the day, you're moving and grooving all day long. You're doing things, you're running around, even if you're just house cleaning and chasing kids, like you are moving, right? So those calories get utilized. You have the same, I'm not even talking like, mindless bag of chips and crackers kind of eating on the couch at night while you're watching your favorite Netflix. Literally, you could have a beautifully healthy but caloric meal with some whole grains and roasted veggies and some grilled tofu, but you're woofing it down at 8, 8:30, 9, and then going to bed at 10. Those are wasted, like they're not getting used by anybody. They're just getting stored then as glycogen and then as fat. So it would behoove you probably on both fronts to shift your eating window to stop earlier in the day, and then to also manage to get some breakfast in.
Wendy, would you like to ask a question, and where are you from?
Yeah, hi, Stephen. This is Wendy. I'm in Boca Raton. And I have 2 questions. One of them is about the mammogram, because I haven't had one in many years. And so I recently went to the gynecologist, and she said that the radiation is different now. It's not dangerous. And then I also asked about thermography, and I was told that it's not effective. It doesn't really find anything. So that's one question. And then another one is I recently went to a conference. It's called Low Carb USA, and they're medical doctors that deal with people that are either have heart issues, diabetes, or obesity. And I talked to a number of people there. They're strictly carnivore or keto, and I mean, they say they've lost a lot of weight and they don't even eat vegetables. By the way, I eat a lot of vegetables, so I'm on your plan. But I don't understand how they have such great outcomes and they feel great and they've been doing it for years. So those are the 2 subjects. Thank you.
Okay, thanks, Wendy. So on the subject of mammograms, unfortunately, radiation has gotten maybe a little worse and not better or safer. And the reason is 3D mammography, which is our latest and greatest. It was FDA approved in 2011. It replaced the 2D mammogram in most centers. And the 3D mammogram has more radiation than the 2D. However, it also has 17% fewer callbacks for false positive findings, and it finds 34% more cancers when going head to head against 2D mammograms. So radiation is ever present and actually increasing. Oops. And it does in fact cause breast cancer. So when people say, like, what do you think about mammograms? It's always difficult for me. I have to individualize it to what their story is, what their concerns are, because they're not wrong. However, I'm a numbers girl. So if you take every 10,000 people doing lifelong mammograms beginning at age 40, you're going to find about, for every 10,000 women, 860 cancers. you are going to cause 8.6 cancers from the radiation from all those mammograms. So we will find and treat 100 times more cancers than we cause with our standard of care use of mammograms. The bigger, more salient question, in my opinion, is, okay, it sounds good to find all these cancers, but now we're into overdiagnosis and overtreatment. So you just, every nail needs a hammer. Are we just surgery, radiation, chemo, anti-estrogens, et cetera, on every single cancer? There are ways to dissect the biology of a cancer and be more single about our approach. You don't need all of these tools. However, people are overtreated. In one estimate, for all the DCIS, it's stage 0, never going to kill you cancer, but could if you leave it there and it evolves. Long story short, we end up doing like 4,000 unnecessary mastectomies every year because we find too much DCIS that's never going to harm someone in her lifetime. So I have this love-hate thing with mammograms, and I can see why maybe you haven't got one, you said, in many, many years. But as I was saying, the bigger question is, how many lives are saved by doing mammograms? How many cancers, do we have to find in order to save one life? So it actually becomes a statistical model kind of thing, but one model from England calculated that for people doing regular mammography, we save 312 lives for every one life that is lost because of the radiation-induced breast cancer. Another model was less. We save 60 lives for every one life lost because of the radiation-induced. So it's individualized. Mammo is still the gold standard. I don't like thermograms. I wish I did. Every 5 years or so, I re-dive into the new literature to see if it's ready for prime time, and it never is, unfortunately. The problem is I've just seen it all. I don't get mad at people who do thermograms, and I'm happily looking at their reports and then trying to hunt down anything weird with ultrasound. But the truth is, I've seen it miss some whoppers of cancers. Like the entire breast is literally a basketball of cancer protruding through the skin, and the thermogram said it was fine. So it has to do with heat patterns, and sometimes we just get tricked by the interpretation of those patterns. It could just be fibrocystic nothingness, extra blood flow, hormonal fluctuation, or sometimes the whole breast can be tumor. So you have to do a clinical exam too, because it's going to have an even heat pattern. Okay, so that's mammos and thermography. Your next question was, all of these people, how do they get away with it? They're happily chomping down on bacon and burgers, and they look thin, and their skin is glowing, and they look healthy. And I think we kind of address this, at least to the extent that I am concerned about those people. And you say they've been doing it for years, and yet, and they're proclaiming such health. And I'm not saying that in a air quotes way that I don't believe that they feel healthy. My question is, are they healthy? So back to the gold standard testing on the insides of them. How are they doing? What is their coronary artery calcium score? Because I bet they have some plaque buildup despite the drop in LDL cholesterol. What is their oral glucose tolerance test? Because I bet their body is going to shoot through the roof with insulin when you spike their glucose, even though their hemoglobin A1C looks okay. So they are probably not going to have the longevity that you're seeking.
Dr. Funk, we really appreciate you sharing this information. How do people stay in touch with you, follow up, get your book? What's the best way?
Please follow me on Instagram at Dr. Kristi Funk, DrKristi Funk, and go to pinklotus.com, where you will find not only our brick and mortar contact info for the breast center, where I'm happy to do Zoom consultations, in-person consultations. You'll also find links to our Elements store, which is one of the world's most robust women's online health stores as it pertains to breast health before, during, or after diagnosis. Tons of really personally, like, I crafted a few of these with my nutraceutical guru. These products are very well vetted in the science and are always vegan. finally, Power Up. It's my online community that is just bursting with ways to connect, to educate. You can find my Cancer Kicking Summit there, which is put on annually in multiple cities across the country. This particular year, there are 2 in October in Hot Springs, Arkansas, and Palm Springs, California. So I hope to see you online or in person soon.
Is your Cancer Kicking Summit online?
There is a virtual downloadable summit that's already pre-recorded, and the live ones have to be in person.
Okay. And if someone really just wants to get all their facts straight, is the best thing to do a personal consultation with you? Like, what would be the first thing if someone says, I heard a lot of stuff, but I'm not sure I absorbed everything and I want to get clear? Should they get your book? Should they do a consultation? Should they go to your Cancer Kicking Summit? What's the best thing to do?
I think you should do it all, ladies, but honestly, the cheapest, most thorough thing would be to get the book and then read it cover to cover, because you and I can't even delve that deep in an hour consultation. But if you have very personal issues that you want, target addressing and looking at something very specific, then contacting the breast center through the website pinklotus.com and asking for a consultation is probably the best way. And of course, I'd love to see you at the summit, which is going to be packed with powerful info on how to transform your life from head to toe, from your heart to your head. You don't want to miss it.
Can we unmute so everyone can say thank you themselves?
Thank you.
Thank you. Thank you so much.
Thank you.
Thank you, Sylvester.
Thank you.